I'm going to turn to the Minister to say a few words, and then each of you can do that, have some brief introductory remarks, and then we'll have a discussion. So, Minister, thank you very much.
First of all, thank you for the invitation. I'm also very pleased to participate to the forum The Economist is organizing every year, annually, here in this magnificent place, because Grand Resort Lagonis is one of the most beautiful places you can be in Athens. And it's always very important to meet people around the world, exchange views about a world that is changing rapidly fast. And of course, it's also a great honor to participate with two other members of this panel, my friend Kavita, the new president of PIF here in Greece. Congratulations for the triumph in the elections. And the professor, Mr. Vandoros, who is always trying to see how things are going in Greece and in other countries around the health sector. So I think we will have a very good discussion, because innovation is the key word for everything.
I agree. Oh, that's what you want.
It's just an opening remark, you said.
Okay. Well, I'm going to come back and ask you some questions, but let me give the chance to our two other speakers to give their perspective on pharma and innovation and why it's important and what's changing.
Sure. So first, thank you so much to The Economist for this invitation and for this discussion. It's a very, very important topic. So as we think about the situation right now in terms of healthcare, and I would speak beyond Greece, right, in Europe, you can appreciate that we have an aging population. You have a rise in non-communicable diseases, and this creates a lot of pressure to our healthcare systems around the world. And we acknowledge that right now those budget pressures are even further strained with a pull on increased investments in defense as well as energy. So this fiscal space is getting smaller. So how do you solve for this problem? And I think that first, we need to think of innovation very differently. If we continue to think of innovation in annual budget cycles, we'll always think of it as an additive to the cost. And you never will be able to realize the long-term gains that innovative medicines can provide. So what do I mean by that? We know that with early treatment, early diagnosis, you can then help patients achieve their outcomes faster, better. Right. They become productive members of society. There's a decrease in the burden to the system, so it can realize cost savings to the system. And you also realize that family and caregivers are also freed up in their time, causing earlier gains in terms of productivity. And many independent studies have shown that €1 invested in innovative medicines leads to a return of €6. And so this requires a shift in terms of how we think about healthcare, not as a cost or a burden to the system, but an investment. Secondly, I would say here in Greece, it's going to require us to move away from fiscal cuts to thinking about structural reform. We acknowledge that budget is limited. We don't have endless amount of budget. However, we need to use the budget that we have very wisely. And this requires a need for creating structural reform that really allocates resources where you can have the greatest impact on patients. So we need to move into a health technology assessment that moves us into a value-based framework, which the ministry is actively working on. And I think that's really important so that we ensure that we're not unilaterally applying the same discount or payback and looking at really what are the medicines that are driving value and recognizing that value in the conversations that we're having. We also need to abolish 511. So some of you may know in Greece, we wait for 5 countries to get reimbursed before patients get access to those medicines. And I think with the implementation of HTA, it's going to be really important that we abolish 511 so that patients don't have to wait so long for that access. And the last thing I'll speak about is shared responsibility. Right now, we're in a system where there is a lot of uncertainty in terms of what that payback will be. And unfortunately, the industry over the last couple of years has been paying more than the state for pharmaceutical innovation. And the latest numbers show that in the hospital segment, where there is most of the innovative medicines, you're at a payback rate of 81%. Of course, this is not sustainable. So we do need to find a solution together. We need to figure out how we rapidly put these structural reforms in place so that we can control pharmaceutical expenditure, but also ensure that the innovative medicines that are bringing value to patients and improving patient lives are being made available to them in a very timely manner.
Well, thank you very much, Kapita, for outlining the issues, the key issues facing the industry and the sector, and obviously patients, of course. So, Sotiris, your take?
Good afternoon, and thanks for the invitation. So, of course, health interventions obviously can help improve health, but the benefits often go beyond the patient. They can increase productivity and therefore have spillover effects on the economy. So, interventions that have a positive clinical value or additional therapeutic value are always something that we should make sure that patients have access to. However, not all medicines bring in additional therapeutic value, and that's why we have to make sure that patients get what they need and that the system doesn't pay for things that do not bring in additional therapeutic value, or they do not pay more for things that do not bring in additional therapeutic value. So HTA, health technology assessment, is what we need in order to make sure that we have a sustainable system and that the patients get what they need and the taxpayers' money is put to good use. So assessing which drugs actually bring in the value for the patients. At the same time, you also need to make other interventions. You have to, apart from the supply side, you also have to address the demand side. There are some therapeutic areas where there might be overprescribing, which is bad for patients. They shouldn't take drugs that they don't need, but also bad for the system as it costs money. Other inefficiencies do exist, and there are several. For example, therapeutic substitution. By coincidence, since we're at an Economist event today, a paper that I wrote on therapeutic substitution some time ago was picked up by the Economist that wrote an article on it, and it highlights how therapeutic substitution can sometimes lead to inefficiencies without creating necessarily any additional therapeutic value to all patients involved. Now, apart from that, if we want a sustainable health system, solutions do lie within the pharmaceutical system, within the healthcare system, but also there are some solutions that lie outside, and we have to address these. I mean, we are facing many challenges, including aging population, including climate change, the lifestyle, the diseases related to lifestyle and so on, and therefore we need smart solutions. We need to take advantage of AI and digital technologies to address any inefficiencies, to improve productivity, because we're also facing a severe labor force shortage in healthcare globally. And of course, we need to take advantage of data and statistics available to make the right predictions about what our needs will be in the future and how we can respond to all these. And of course, behavioral nudges, behavioral interventions, extremely important for the healthcare system, and we need to act on that in order to also improve the lifestyles that lead to improved health. Now, when it comes to Greece and creating an innovative environment, or an environment that can attract R&D as a hub, well, let's start with clinical trials. What do clinical trials need? They need speed, they need fast approvals, they need to cut red tape. You need, of course, the tight collaboration and good collaboration between universities, academia, industry, and the government. And you need, of course, the space and the infrastructure. Now, several of these have been addressed already, I understand, in new regulations that will be implemented soon. So it's vital that these are that these translate to practice soon. But I think Greece could be bold and optimistic and strive for more. I mean, why limit this to clinical trials? You can go way beyond. I mean, clinical trials already, while there is an increase in approvals in Greece, a lot of them are shifting towards China and the US, right? China used to have 6% of the global clinical trials 10 years ago, and now they have a third of the global market. So it's a challenging environment, and Greece can also look beyond that to innovation more generally. So why not also think about preclinical research, preclinical R&D? I know it's a bold move, but you have to look at the strengths and the weaknesses of Greece and act on that. What are the weaknesses to address them? What are the strengths to capitalize? According to Eurostat data, there's been a massive increase in R&D investment in Greece over the past decade. We're still below, the country is still below the EU average, but there has been a massive increase. If you look at the mix, this is largely driven by government spending on R&D. So what's lacking is the business investment in R&D, and we need to understand what are the obstacles. So looking at the Global Innovation Index, where does Greece seem to be doing well? They seem to be doing well in human capital and on research, but they seem to be lagging behind in institutions, which is really important, on business sophistication and market sophistication. So these are areas where you need to act on in order to attract the venture capital that you need, all the funding that you need in order to create this environment. And finally, and I'm just finishing off, Greece is home to a lot of manufacturing, pharmaceutical manufacturing, many plants that supply and also export. So such an innovation hub, such an area where R&D would be locally, could blend in with the manufacturing capacity.
Okay, thank you very much. Well, we've got a very heavy agenda of topics to discuss there, raised by our two speakers, ministers. So maybe we can try and break it down a little bit. And if I may, maybe we can start with the Greek farmer clawback issue, which is this mandatory payback policy, which was introduced as a temporary measure, austerity measure, back in 2012. And it remains, and payments have been skyrocketing to an estimated, I think, 2 billion euros annually. And obviously that has all sorts of consequences in terms of access to new therapies, implications for pharma companies who may be disincentivized to bring products to Greece. So I do want to focus on what's changing and solutions, and both of the speakers emphasize that, practically to find solutions. Is it about increasing government funding for medicines, capping the clawback rates, the shared responsibility that was mentioned, controlling prescribing habits? How do you see a way out of this?
Okay. First of all, I was Minister of Health 12 years ago when we first implemented the clawback system. I'm very proud about it. I never assumed it would be temporary. I can tell you that a payback system, whatever name you can give it, it will be here as long as the sun still rises every day. So you don't have to fight something that is so true as the light of the sun. It will come. The only real discussion we can have is how we can make it just and sustainable. This is a good story to talk about. First of all, more government spending. We are giving more money. In the last 7 years, our state gave approximately 800 million more per year. For the Greek economy, this is a big amount of money. Let me make it more simple for you because you're not an expert. For almost 12 years, our budget was frozen. And only during our term, it's not frozen, and we give a lot of money every day. Even in the hospital drugs that my friend Kavita named as 81%, it's not 81%, it will be, and it was something like 75% for the drugs that are not in closed budget deals, which is just a part of these drugs, because many of these drugs are much lower. I'm not saying 75 is good, let me be very frank, but it's not 81. And it's 75 with much more government spending. I mean, the companies earn more money in Greece with the 75 than some years ago, maybe with 70 or with 72, because we spend more money. And now this is the big question. What can we do with innovative drugs that, of course, I hear all these good stories that innovation gives back €6 for one and in the future will help more productivity, which is all true, I don't dispute. But this is a much more long-term investment. During my budget, the investment that will give us back money to the system after 2 years, 3 years, onto the rest part of the economy doesn't really make a lot of difference. Because I have a budget, I have to spend it, and I have to find a way to spend it in a more just and sophisticated way. So, I will give you an example. When I became Minister of Health for the second time in 2024, the registered patients in our hospital that were using the very expensive immunotherapies were approximately 11,000. 2025, there were 23,000. 26, there will be more than 31,000. Each one of them cost the system maybe even 300,000 euros per year. So if you have 20–30% increase per year in this kind of money, whatever budget you give, it will be vaporized. It is so simple as that. So for a state that has recently passed through a bankruptcy, just saying I will give more money is not a clever idea. The last time we did that, IMF came to save us, and it was a very terrible experience. We don't want to have it again. So what we're talking about, and with the pharmaceutical industry, first of all, we have already implemented a lot of measures to control the overprescription system. Now have a new tender for implementing AI systems into our electronic e-prescription system in order to be able to track any corruption or any overprescription or everything else. Next week, we will implement, eventually, the SPC filter that will start really block a lot of the overprescription that we have in the country, and this will save some money. This will not save us, but will save some money. The second thing we're going to do is that we took our, until yesterday, Secretary of General, Mr. Angelis, which I want to thank him for our collaboration in the ministry all these years, and we're going to establish an HTA organization in order to start examining all the drugs in a cost-benefit basis, to see exactly each drug we pay, what really they deliver to our patient, and how this really affects our national healthcare system. This will be a very sophisticated system. We have studied a lot of other European models in order to make it work. We'll have our legislation until the end of July. I think it will be ready to fully implement it early 2027. And Aris will be the first director of this HTA organization. So we will be able to be sure that we're going to pay the right medicines to the right cost. Of course, this will provide us a space to give more money to the drugs that they really work and less money to the drugs that at the end we didn't need them so much. So we're going to use all these sophisticated tools to make it working better. Even what Kavita said before, we had this 5 countries rule for the main positive list. We will extract this rule. We put it in the IFET channel, so we will try to push companies more to go to the right channel with the clawback system than going to the back channel of IFET. That really, IFET is the back channel we have in order to avoid a patient that doesn't have his drug, but they're excluded from the clawback system, and this creates a lot of misunderstanding between us, let's say, in a polite way. So we have a full kind of policies to make it more just and more functionable. But I have to be very honest, Mrs. Gogozotou and her team will always be here. And Mrs. Daphne Nicolaou, who is the new Secretary of General, and I want to congratulate her for the appointment. She will have her office always open to see the new legislation and the timeline we have to keep in order to be very, very productive. So for the second thing Mr. Van Doros posed, I mean, how we can attract more R&D investments in Greece, which is something I care a lot about. First of all, we're going to change the law about the clinical trials phase 1, and what will give the authority for the autonomous centers of clinical trials, not only into the hospitals. So we'll give a lot of incentives for more companies to participate to phase 1 clinical trials. And second, we have already implemented a lot of reforms to make the license more fast, and all this has already happened and is still implementing as we speak, and they have already made a difference. But the biggest hope we have is to use all this huge data now we are collecting, because many people don't know, and I'm very proud about it. During my term, Greece digitalized our healthcare system 100%. I don't know if you know that each Greek, in their phone, they have medical record, they can have an appointment with a doctor, have an e-prescription system, have an MRIs, have everything through a digital system. So we collect data from 11 billion people every day. What we're going to do now, we're going to vote. I will present it into the cabinet meeting on the 30th of July in order to have it in public consultation in August and voted in September, the secondary use of all this data. I think this secondary use of all this data, with the incentives we bring, and the new technologies that pass through AI and data, because now R&D research depends more on the data than in the clinical phase. We will be a very attractive part of the world, because you see, my friend Mr. Vandoros, Greece is not too small in order not to be relevant, but it's not too big in order to be difficult to govern. We're in a middle-sized country, 11 million people, but with a unified digital system that one person decides. In this period, it happens to be me. But even if it wasn't for my case, my successor also would follow this path, I'm sure. So we can provide a lot of things to the companies that will want to come and use this data for their own research reason. For them, save a lot of money and time, and for us, attract a lot of new investments.
Great, thanks very much. Maybe just to give you the chance to comment on a couple of other issues that were raised before I bring the two speakers back. One is the labour force issue, and how you see that. And
Labour.
Yeah, the labour issue. Just quickly on that, because actually we're already in the red in terms of time, but we've got a few more minutes, so don't worry.
First of all, maybe the people here knows it, but I'm just referring to people that will see it from the internet and they're not so familiar. Greece have a very productive and very competitive pharmaceutical industry. Of course, in generic drugs more, but as time goes by, they enter to innovation very fast in biosimilar and everything. So we have already established a labor force that is used to work to pharmaceutical industry. And I will tell you what we did in a very special case. During my term, the Minister of Development and Investment, since I was the minister, I had invented the clawback system, and this made me feel some nightmares as a person that did something that was not very capitalistic for my taste. I invented the investment clawback. I decided to use the clawback as an investment tool in a different way. This generated a lot of investments in our pharmaceutical industry, and one of the things we did with Mr. Kondozamanis, who was there, the Alter Minister of Health, we decided to make this pharmaceutical hub in Tripoli. Already 2 big factories have already established from Mr. Demos and from Mr. Trifon in Tripoli, from El Pen and Demos, and a new one from Faran, from Mr. Katskas is being built, and 4 more has already been licensed to be built there. In order to find laborers, we built a school into Tripoli, and we educated young people how they can work in the pharmaceutical industry. And all the people that graduate from the school we built in Tripoli, they find job in Mr. Trifon and Mr. Demos industry. And this will scale up. So we are following the labor force issue also.
Thank you very much. So we've got very little time, but obviously I want you to be able to come back.
They can only say the minister is perfect and everything was okay.
Yes,
and,
don't be scared.
I'm going to finish this session.
So Sotiris, maybe you first of all. to reflect on what you've heard, the response from the minister, and anything else that you want, because this is going to be final remarks.
Yes, thank you. So organizations and individuals respond to incentives, right? So we need the talent. We need to attract people to work in these R&D intensive or pharma intensive jobs. So it's important to provide the right incentives and the right framework. Then there's the institution aspect where the standard issues that attract businesses, not only in pharmaceuticals but in general. You need the funding as well. You need the flexibility. You need the infrastructure. So all these things are a mix that can then end up attracting venture capital and other sorts of funding in order to boost innovation. Now, you also mentioned the issue about funding. Well, I think it's a matter of mix and about investing in the drugs that actually, or giving access to patients for the drugs that actually matter to them. Mm-hmm. So HTA, I think, will, to a large extent, solve this thing about the sustainability. You need to increase efficiency, fund what makes a difference for the patients, and then seek efficiencies elsewhere in the system, as some demand-side measures that already have been implemented, the continuous monitoring and data and feedback, the use of AI to understand the trends, understand what's going right, what's not going right, what needs to be, what kind of interventions need to be done early on rather than later. And of course, addressing also, I think it's more of a matter of addressing the out-of-pocket elements that is, patients pay for a large part or on average of their pharma spending. So that's also something that needs to be addressed. And of course, we must avoid the mistakes of the past. Greece used to have it used to be number one in per capita expenditure in pharmaceuticals in the EU, and then the crisis happened. Mm-hmm. And this steep increase I'm not implying that it was caused by that, of course, but I'm just saying that, the fiscal element of the side. And of course, public pharmaceutical expenditure in Greece from 2005 to 2009 increased from 2.9 billion to 5.1 billion, and then had to come down very, very steeply. So I think it's a matter of, and I don't think that the population's health really improved proportionately during those periods with a steep increase in funding. So I think it's a matter of HTA giving patients access to the medicines they need, but also having an efficient system that provides the additional medical and therapeutic value where possible. That provides the additional therapeutic value to patients, but uses HTA to filter out anything that does not provide additional therapeutic value to the patients.
Okay, thank you very much for that, Kavita. You're going to have the final word, unless the minister's going to come back and say something.
So be careful.
Well, at least the minister and I agree that 75% is not sustainable.
Yes.
Right.
I agree.
Okay, wonderful. For any business. And, the minister spoke about various measures to control expenditure, as well as structural reforms to change the system. And myself and the industry are very much advocates of these, and we stand with the state to put these in place, because we know that this is necessary. We have to move away from a cost containment system to a value-based system. Mm-hmm. And we need to do this with great urgency, right? And I say with great urgency, as everyone in this room knows that EU is trying to be competitive. Greece is trying to be competitive. Companies are making decisions. Greece has made great strides as it relates to its local industry, right? With a thriving manufacturing industry in terms of generics and biosimilars. I see this as an and. Can you imagine where Greece would be if it was a system that was innovation friendly and would bring investments in from multinationals? We know that multinationals will invest in countries where they believe they can have sustainable access to their innovation. And right now, those decisions are being made. So we must act with great urgency so that those investments do come in, and Greece has the opportunity to become a regional hub in R&D, because we do have great talent. We have great scientists, we have great researchers. Now we need to ensure that there's a system in place that is attractive to use that talent and researchers to make Greece an innovation hub.
Thank you. Nothing to disagree with there, I guess,
No,
Minister?
I have to be first of all, because I don't want to think someone that I dispute with capital, with the industry.
Very
My main goal is to reduce clawback. Okay, but I have to do it in a just way for everybody. And this is the reason why we work, and we work together.